So as we know, history has shown us that prohibition isn't really a good strategy. There's been multiple times that things have been prohibited, and it's only increased the rise of the black market industry. When I was doing some searching online about this topic, I found forums that were written by current firefighters and some police officers that are already using steroids to improve their job performance. And one of the concerns that these firefighters have is that when they go to their physicians, they're not comfortable telling their physicians that they're actually using the steroids. And so they're not necessarily getting appropriate medical management for themselves. If their physicians knew that they were on the steroids, the side effects of the steroids could be mitigated by putting the patients on statins, as we know that steroids increase the cholesterol levels in people that take them. And then additionally, a lot of the cardiac side effects could be mitigated by proper management of blood pressure. So aside from the proper management of the side effects, it's also been shown effective in improving job performance.
So yeah, there's a study here conducted in 2004 through the Journal of Strength and Conditioning, which took 20 firefighters and it put them through several rigorous tests designed to reflect real-world scenarios. And the results showed that the muscular strength and endurance were positively correlated with their job performance. So we know that there's efficacy when they are used as far as job performance goes.
And the last point we're going to make for our positive stance is that every drug has a limit where it becomes dangerous, and that includes steroids. But the important thing is that the dose makes the poison. And just because a drug has potential to be dangerous doesn't mean it should be eliminated from use or potential use. And in this situation, there is definitely potential benefit for firefighters to be using steroids under medical supervision, even though there is potential for negative side effects.
So, you guys good?
Yes.
Okay.
Oh, you're finished already.
So moving on to the opposing arguments regarding steroid use in firefighters. First, we would like to look at just the general side effects that we would see with the use of steroids. This, of course, the most well-known would be the psychological effects that could increase the risk of aggressiveness or hostility in these individuals, which could lead to a higher potential for violence. Of course, there is the CV side effects that could happen, such as atherosclerosis, MI, severe cardiomyopathies, etc. Again, there are hepatic issues that we have to keep in mind, such as the elevated LFTs and the potential for cholestatic jaundice and hepatitis. Renal effects, the elevated SCR, BUN, uric acid, potential for acute renal failure. Smaller effects that we might see, like hirsutism and acne. And of course, the issue with reproductive capabilities afterwards that could be impaired. Following that, we look at the fire-related deaths that have been declining since the early 2000s. Now, we see that the numbers have dropped from 3,925 in 2003 to 3,005 in 2011. During this time, steroids were not being used. This means that there is a decrease in fire-related deaths regardless of the use of steroids. In these cases, we see that the CDC has looked at the reduction in overall fire and fire-related deaths has been due to prevention programs such as improved education or better fire detection technologies in households and buildings. In this case, we would like to more focus on a potential for spending more time and money on how we educate people about fire safety and also the fire detection technology we have in these facilities.
So one of our arguments for being against the use of steroids in firefighters is that we don't know the long-term effects of anabolic steroid use. So obviously we know that athletes have been abusing this substance for years, but we're vastly lagging behind in terms of their safety and efficacy in patients. So as you all know, obviously, although Jeremy has discussed the short-term data in terms of the side effects they could experience like immediately or in the weeks after, we don't know the long-term effects on things like their cardiovascular system and stuff like that. And as healthcare providers, we know, like, a lot of the times when we make guidelines, we make recommendations, it's based on the clinical efficacy and the long-term data. So say we won't prescribe a medication for short-term use if we think that long-term it doesn't benefit the patient. So because we don't have that information, it doesn't seem like a plausible reason for the short term that they might, have excess, athletic ability or increased strength and stuff like that. If in the long term they will be at increased risk of cardiovascular disease and other complications that we have not yet studied enough.
Yeah, I'd like to start off with an ethical standpoint, and then I'll finish off with a safety standpoint. So first, it's unethical to force your employees to take medication to increase their work performance, especially when there's a lack of a disease indication for that medication. So ladies and gentlemen, since when do we allow employers to make unneeded drug use a part of a job description? If we force firefighters to take anabolic steroids, where will it stop after that? It's obvious that this will set a precedent among other employers in order to validate drug use in their employees as well. Soon we'll force our police officers, our Army personnel to take performance-enhancing steroids, and eventually it could snowball to the point where we're forcing moving companies to have their movers take steroids as well. There could even be hostility between these workers as far as those choosing to take the steroids and those not choosing to take the steroids, and those on the choosing side saying that the non-choosing side are not worthy of a raise because they're not working as efficiently. So obviously it can create some hostility in the workforce as well. It also has the potential to encourage other classes of harmful substances to be forced on their employees as well down the line. Again, will employers start requiring their workers to take prescription medications like amphetamines in order to increase focus and efficiency in the workforce? As you can see, this opens up a big can of worms and a lot of issues. The bottom line here is that no worker should be forced to take performance-enhancing medication and be in an environment where they feel inadequate to their peers if they do not. And secondly, and even more importantly, is the safety aspect. Anabolic steroids will not reduce on-duty deaths of firefighters and may even increase them. So according to the National Fire Protection Association, in 2014, 64 firefighters died while on duty. 42% of these deaths were due to accidents on the job, and these included things like crashes, being hit by falling debris or falling themselves from high places, fires and explosions, and electric shocks. That means right away, 42% of the deaths of our firefighters were from situations where anabolic steroids will have no benefit whatsoever in the first place. The other 50% of the deaths were from acute medical conditions from stress and overexertion while responding to a call. Majority of these overexertion deaths were due to sudden cardiac death. That's 56%. And each year, sudden cardiac death is actually the leading cause of on-duty firefighter-related deaths. Now, while some might argue that steroids can increase strength and prevent this exertion, the reality is that anabolic steroids have been shown to increase cardiovascular problems such as heart attacks, cardiomyopathy, and stroke, as Jeremy mentioned, and therefore they could further contribute to sudden cardiac death in these firefighters. This can accelerate an already dangerous health condition in this field and increase the risk of death both on and off the job. So not only, to wrap up, are steroids not preventing 42% of the deaths, but they could be further exacerbating the other 58% of the deaths.
Thank you very much. Both groups.